Welcome! Simulation learning is meant to offer you the opportunity to participate in a scenario which mimics the clinical environment. It is a time to put what you have learned in the classroom about different disease processes, skills, and caring for your patients into practice.
The goal of this video is to give you some basic information about simulation, the equipment you may use, how to interact with various types of mannequins, and introduce you to the process of debriefing, all in an effort to help prepare you for your upcoming simulation experience.
Simulation is meant to be a non-judgmental environment where mistakes are allowed and sometimes even encouraged. While a simulation experience may be graded, the ultimate goal of simulation is to learn. So if you make a mistake, apply what you learn and use that knowledge to improve on your next simulation. It is far better to make an error during simulation and learn from it than to make an error during clinical, causing harm to the patient or yourself. Let's get started with the tour.
Not every simulation lab will look the same, but many will have similar areas. Most simulation labs have a main room that is either set up to look like a single patient room or is divided into several patient rooms. Most of these mock patient rooms will have a patient bed, a monitor, a bedside table, a cabinet for patient equipment, a cabinet for personal protective equipment, and maybe even a chair for a patient visitor to sit in. As you start doing more advanced simulations, there may be more specialized equipment involved.
Depending on the type of simulation, your instructor might simply tell you the patient's vital signs or show you vital signs written on a piece of paper to indicate what your patient is experiencing.
Your patient's heart rate is 80 and your respiratory rate is 20.
The instructor may use their smartphone or a laptop to show vital signs and waveforms, or they may use an actual patient monitor either mounted on the wall or on a bedside stand.
Adjacent to the mock patient room or rooms is usually a control room of some sort. This is where the instructor or simulation coordinator may be sitting during your simulation experience. They act as the voice and pathophysiology of the patient you will be interacting with, playing out the signs and symptoms of the patient.
You may start your simulation now.
Depending on what type of simulation you experience, your instructor may use a microphone in the control room to give your patient a voice or to give direction to you on how to proceed through the scenario.
The focus of the sim lab will be the mannequin or your patient and your interaction with them. Students are expected to interact professionally throughout the simulation. The mannequin may be a static mannequin, meaning it doesn't interact with you. Think of Annie, the CPR mannequin, who just lays there while you perform CPR. These types of mannequins are generally used for task-type simulations when you may be required to perform a skill you've recently learned in class. If the static mannequin has a voice, speak to the mannequin just like you would a real person.
I'm just not feeling too good today.
Oh no, could you please tell me some more about that?
During some simulations, you may interact with a high-fidelity mannequin who offers the ability to hear breath sounds, a heartbeat, and even feel pulses. When interacting with a high-fidelity mannequin, make sure you are treating it like a live human being. For example, you wouldn't ask a patient what their heart rate is, you would listen to their heart rate, or look at their vital signs on the monitor. Do the same with a high-fidelity mannequin.
All right, Mr. Jones, I'm going to listen to some of your breath sounds.
Sometimes, actors may play the part of a patient who will be able to interact with you. They will usually have a disease process delegated to them by your instructor, and they will respond with signs or symptoms aimed at mimicking a disease pathology. You can ask them direct questions about their symptoms and practice nursing assessments relevant to the information they provide.
Well, how are you feeling today?
Some simulation scenarios may be task-oriented, such as practicing a specific skill. Some scenarios may require you to perform a physical assessment, while others may have you multitask with the skill while answering questions from the patient or family members at the bedside.
I'm going to be asking you some questions about your health history, and then I'm going to perform a physical exam.
Reading your pre-simulation materials thoroughly prior to simulation time will help you prepare for these experiences. Your simulation experience may be related to the content you're already learning in the classroom. You may even be allowed to come into the lab early to practice before going to your formative assessment. Ask your instructor for any information you feel you may need, but remember, they may not tell you everything. The purpose of a simulation is to help you learn to connect theory to real experiences and use your critical thinking skills.
An important aspect to remember about participating in sim scenarios is to gather any information you can about your patient during the simulation. Vital signs are an important part of your nursing assessment, but make sure you pay attention to your patient in a holistic way. This includes their emotional status, their environment, and those around them. As a nurse, you won't ignore these important aspects for a live patient, so don't ignore them during a simulation either. If you're working with a partner or team during a simulation, don't be afraid to ask questions or even think out loud with your group. Think of the nursing process like the work of a detective. You need to gather all the evidence or information you can and then put it together to figure out what is going on with your patient.
Okay, we know what her blood pressure is and her respiratory rate. Is there anything else we need to look at?
Well,
Once you have completed your sim scenario, some form of debriefing will take place. Some instructors utilize videotaping to capture you or your team in action. Others may simply choose to discuss the scenario based on notes that they took while observing your simulation experience. It can be intimidating to see yourself on a video or hear feedback about your performance. But try to think of debriefing as a tool for you to gain understanding of how you can improve. Mistakes are not really mistakes in this environment and should only be seen as areas to improve your practice, your nursing skills, and your patient's safety.
Another important aspect of debriefing is to be honest. These are the conversations that will make you a better nurse, better patient advocate, and a better critical thinker. Ask me any questions you want. Simulation and debriefing are learning experiences for you, so use them.
We hope this informational video has helped to answer some of your questions about simulation and helped to prepare you for your first simulation experience. Remember, simulation is a safe environment for you to work toward becoming knowledgeable, compassionate, and experienced nurses. Good
Good luck!